Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching that earwax removal compilation video today. Two very different patients in this compilation. You can see this first patient here has got this really thick, sticky wax. I know we did a lot of this yesterday, but very thick, sticky wax at the entrance to the ear canal. Second patient is more of a peel, so make sure you stay tuned for that one, because it's quite a good one to watch that one. So we can see we've got this initial section. It looked quite soft and sticky, but when we detach it, you can see it's a little bit harder just beyond. So it's a very different consistency from the outer part of the ear canal to the innermost part, from the lateral to the medial part of the canal. So we're having to use the Jobson horn here just to pull this forwards. There we go. You can see it blurred the camera just a little bit, just because as we pulled it forwards, it just touched on the edge of the camera lens and it just caused this little bit of blurring. You can see I'm having a little bit of difficulty picking this up. It didn't want to come out, but it all came out in one big piece. So that's what it looked like to start with. This is what it looks like afterwards. You can see a very different ear canal there. Now this is a second ear canal, or the other ear canal I should say, sorry, rather than the second or third. So you can see now, very similar story here. This softer wax here at the entrance, but see how this wax is stuck to this right hand side of the canal wall here. So it's stuck all the way down. Now we're just trying to detach it a little bit there. You saw a bit of blurring again. That's the olive oil we've introduced here. Some patients, we always advise for everyone to use olive oil. Not everybody likes using it, because sometimes it can make you feel a little bit more blocked up, because if there's a little gap around the wax, when the olive oil goes in, it will block that up. So some patients are a little bit reluctant to use it, but it does make a big difference when we're using microsuction. It just softens the edges of the wax, especially when you see something like this. It's a long, dry, hard, sort of dark piece of wax here. You can see it's going back a fair way. I've pulled it out the ear canal quite a bit, and just to try and get beyond that now to this next section. So we're just lifting from the side here. Oops, there we go. Let's give this a little bit of a wiggle. You'll see how long this was. We've already broken one piece off here, but look how long that section was there, going right back into the ear canal. Eardrum looking lovely and healthy there though. So we're just gonna tidy up a couple of these little pieces on the outside edge here. Not really going to affect anything as far as hearing's concerned, these pieces. This is more just a little bit of tidying up than anything else. There we are, eardrum looking nice and healthy on that side. So this is what it looked like to start with, and what it looks like afterwards. There we go. So this is what we removed, 3.5 centimeters. Or actually, if I budge that across a little bit, it's probably, no, that'd still be 3.5. So 3.5 centimeters, 1.25 inches there, guys. And you can see the color differences from those much softer sections at the front end, the sort of more lateral end of the ear canal there, and those much darker sections. Ooh, now this was a good one. Now this lovely lady came through a couple of weeks ago, ear feeling very itchy, and basically no pain, no discharge, just feeling a little bit uncomfortable, very blocked up. When I looked in the ear canals, what this patient had was something called a tictus externa, which is where you get an inflammation or an irritation to the outer parts of the ear canal, and what happens then, it just starts to swell the canal up, and some people, if there's a bit of discharge there as well, it can feel a little bit itchy. So it's like a mild sort of outer ear infection, if you like. So we cleared away as much debris as we could back a couple of weeks ago. I advised my patient to go away, get some treatment for that, and then to come back. Now I always like patients to come back post-treatment, because this tends to happen a lot. What you can see here is we get this very thin, sticky layer of it was infected debris, but now the infection's gone. It's just debris that's left in here, but it always adheres really well to the canal wall. So this would be the sort of discharge that the patient was getting. And as the treatment goes in, obviously it takes a few days for the treatment to kick in, that discharge tends to solidify on the canal and the eardrum, and that's what's happened here. Now I'm using the fine end because I've got to very gently lift this off the canal wall. What just makes things a little bit more awkward is a little bump on the canal wall. You'll see it just on the, it'll be on your left hand side. So just on the left hand side, you can just about see there with the dark wax, it sort of wraps around it a little bit. So I'm trying to peel this away. I've put a bit of olive oil in here just to help that when I start to lift this, it's going to help it not to stick back down, and it's going to help with that peel along the canal wall. It's a little bit gentler on the skin. So as we're lifting this up, obviously we know the canal walls are really sensitive, so we don't want that to cause any discomfort to the patient. So we put a bit of olive oil in there first of all, and that just helps to soften everything, and it's a nicer peel away. So you can see I'm working just on the side now. There we go, trying to lift this off. And this is one whole block here, this front section with these dark pieces of wax. We've got it away, so great for crocodile forceps in here now. So this is the fine end crocodile forceps going in. Fine jaw, not fine end, sorry. So we're just pulling this away now. You can see as we start to pull that out, There we go. You can see that whole section just come away there. But let's take a look beyond that. That's that first initial section we had there stuck to the canal wall. You can see it really kind of drop down. But look at this section that's going over the eardrum as well. Now that's all connected to that section you can see on the left-hand side. You can really see that bump just down from the suction tube there. You can see that little lump on the canal wall there. Now that might be a hang-up from the actual infection itself, a little bit of irritation in there. Can sometimes cause these little lumps and bumps in the ear canal. But I'm trying to lift this. You can see the fine end here, just how narrow and thin this piece is here. We're really struggling to get a good grip on this, and it goes really solid, so it's a hard piece to get hold of. So I'm just trying to lift it away and around that bump. Let's see if we can get it off that first of all. There we go. So that's got it off. So let's go in now with the forceps. Let's grab this initial front section. Let's see if we can lift a little bit higher. There we go. But look at that peel. It's going all the way down the canal and across the eardrum. This is one solid piece. Keep an eye on this as it's coming away. Here we go. Look at this coming away. Look at that peeling away, all off the eardrum and off the side of the canal wall, all in one piece as well. Look at that go, guys. That is huge. Lovely. Very satisfying when it all comes out in one piece like that. Guys, if you do enjoy these videos, then don't forget you can like, you can heart, you can follow, you can share, and you can subscribe. That would be absolutely fantastic. Lovely looking eardrum. They're looking very different. So these are the two pieces we removed. So 1 centimeter, half an inch there, guys, in that one ear canal. So guys, I hope you enjoyed that video as much as I did voicing it over. Thank you very much. I still haven't caught up with all the comments. I did try and respond to a couple last night. I will try and catch up with last week's as well at some point today, fingers crossed. So as always, guys, take care of yourselves, take care of your ears, and take care of one another. And I'll see you again real soon. Bye, everyone.